Lecture 41. Unusual medical conditions and their treatments within the labyrinth of modern medicine lie enigmas that continue to baffle even the most brilliant minds. Cases where the human body rebels against its own nature, where reality warps, and where conventional understanding fails. I'm Dr. Eleanor Richards, and today we venture into the shadowy realm of medical mysteries, conditions so rare, so peculiar, that they challenge the very foundations of medical science. Welcome to Unusual Medical Conditions and Their Treatments, where the extraordinary becomes clinical and the impossible becomes diagnosed. Imagine waking one morning to find your hands have grown to enormous proportions, while your bedroom seems to have shrunk to dollhouse dimensions. For sufferers of Alice in Wonderland Syndrome, this distortion of reality isn't fantasy, it's their perceptual truth. Named after Lewis Carroll's famous tale, this neurological condition warps perception of size and distance. Objects may appear impossibly small or overwhelmingly large. The room might stretch away like a tunnel or compress into suffocating proximity. What makes this condition particularly baffling is that the patient's understanding remains intact. They know these distortions aren't real, yet cannot escape them. The cause, most commonly, AIWS manifests during childhood migraines, viral infections, or epileptic episodes. The temporal lobe, that mysterious region governing perception, becomes temporarily dysregulated. Treatment focuses primarily on addressing underlying causes. Anti-migraine medications show promise, while anticonvulsants help when epilepsy is the trigger. Interestingly, most childhood cases resolve spontaneously with age, as if the brain eventually finds its way back from Wonderland. But for some adults, particularly those whose condition stems from brain lesions, the distortions may persist indefinitely, a permanent shift in their experiential reality. Imagine this scenario. A woman from rural Georgia suffers a mild stroke. Upon recovery, she opens her mouth to speak, and the voice that emerges carries not her native Southern drawl, but the crisp consonants of a British accent she's never studied or heard extensively. This is foreign accent syndrome, one of medicine's most perplexing vocal curiosities. Documented in fewer than 100 cases worldwide, it typically follows stroke, traumatic brain injury, or severe migraines. What makes this condition so captivating is its specificity. The brain's language centers are damaged in precisely such a way that pronunciation, intonation, and rhythm shift to mimic an accent the patient has never possessed. Treatment remains elusive. Speech therapy can help patients regain control over vocal patterns, but the foreign accent often persists. The psychological impact cannot be overstated. Imagine suddenly speaking with a voice that feels fundamentally not your own. Perhaps most fascinating is what this condition reveals about language itself, that what we perceive as accents are actually specific patterns of muscular movements and timing, which can be inadvertently adopted through highly specific brain injuries. The human voice, it seems, can be made foreign by the brain's own misguided repairs. Now, imagine being allergic to the very substance that comprises 60% of your body water. Aquagenic urticaria, commonly called water allergy, manifests as painful hives, redness, and intense itching upon contact with water of any temperature. Even tears running down one's face or sweat beading on the skin can trigger excruciating reactions. This condition exists in the shadowy borders of immunology, affecting predominantly young women for reasons still shrouded in mystery. The pathophysiology remains contested. Some researchers propose that water interacts with sebum or sweat to create a toxic compound on the skin surface. Others suggest water might temporarily alter the osmotic pressure of hair follicles, triggering mast cells to release histamine. Management, rather than cure, is the goal. Antihistamines provide some relief, while barrier creams create temporary protection. The most effective approach combines medication with lifestyle adaptation, brief showers, blotting rather than wiping tears, and avoiding precipitation. Imagine a life where rainfall becomes your enemy, where bathing is an exercise in calculated risk. This is the reality for those with aquagenic urticaria. Perhaps most chilling among our medical mysteries is fibrodysplasia ossificans progressiva, dramatically called Stone Man syndrome. In this genetic nightmare, soft tissue muscles, tendons, ligaments, gradually transforms into bone. It begins in childhood. A fall, a bump, an injection, any trauma triggers inflammation that, instead of healing normally, calcifies. Joints lock permanently. Movement becomes increasingly impossible. The body entombs itself within a second skeleton. With only about 800 confirmed cases worldwide, FOP is defined by a cruel paradox. Attempts at surgical removal of the excess bone trigger more bone formation. The genetic culprit was identified in 2006, a mutation in the ACVR1 gene that regulates bone formation. This discovery sparked new research pathways, leading to promising experimental treatments. Palovarotene, a retinoic acid receptor gamma agonist, has shown potential in preventing heterotopic ossification. Meanwhile, anti-inflammatory approaches target the initial trauma response that triggers bone formation. Yet the condition progresses insidiously. Most patients become immobilized by their 30s, often dying from complications related to restricted chest movement. In FOP, we witness the body's regenerative processes turned against itself, healing transformed into progressive imprisonment. Let us now descend into the darkest corners of neuropsychiatry, where we find Cotard's delusion, the chilling belief that one is already dead, has lost blood or internal organs, or simply does not exist. First described by French neurologist Jules Cotard in 1880, this condition represents one of psychiatry's most profound enigmas. Patients may believe they are walking corpses, their bodies putrefying despite evidence to the contrary. Some refuse food, seeing no need for sustenance when already deceased. Others cannot recognize their reflection, convinced that mirrors show only emptiness where they should be. Cotard's typically emerges alongside severe depression, schizophrenia, or neurological conditions affecting the parietal lobe. Treatment combines electroconvulsive therapy, antipsychotics, and antidepressants. Remarkably, some patients recover completely, emerging from this existential abyss to reclaim their sense of being. Others remain trapped in this macabre delusion, inhabiting a reality where they exist only as ghosts of themselves. What makes Cotard so philosophically fascinating is how it undermines our most fundamental certainty, that we exist. In these patients, Descartes' famous, "I think, therefore I am," becomes devastatingly inverted. Equally unsettling is alien hand syndrome, where one hand operates with apparent autonomy, performing complex actions against the person's conscious will. Following certain brain injuries or surgeries, particularly those affecting the corpus callosum, connecting the brain's hemispheres, patients report their hand developing a mind of its own. This rogue limb might unbutton shirts the other hand just buttoned, grab objects unbidden, or even exhibit aggressive behavior toward the patient's own body. Most disturbingly, the hand's actions often appear purposeful rather than random, as if guided by independent intention. Treatment remains largely behavioral. Patients learn to occupy the wayward hand with objects, keeping it busy to prevent unwanted actions. Some find success with mirror therapy or constraint-induced movement techniques. The syndrome provides a haunting glimpse into the fragmented nature of consciousness itself, suggesting that our sense of unified self-control may be more illusion than reality. In the words of one patient, "I never know what this hand is going to do next. It's like living with a stranger attached to my body." Now we turn to a condition that may have spawned centuries of folklore porphyria, sometimes called vampire disease. This group of metabolic disorders disrupts heme production, leading to accumulation of porphyrins that wreak havoc throughout the body. The most dramatic variant, erythropoietic protoporphyria, renders patients extremely sensitive to sunlight exposure, causes skin to blister, burn, and scar severely. Some patients develop reddish teeth and receding gums, while others experience psychiatric symptoms including paranoia and hallucinations. The vampire connection? Historically, sufferers would avoid sunlight, possibly exhibit altered appearance including reddened teeth, and might have sought animal blood for therapeutic heme. Some researchers speculate this condition inspired vampire mythology. Modern treatment includes blood transfusions, hematine injections, and beta-carotene supplementation. Bone marrow transplantation offers potential cure in severe cases. Perhaps most poetically, patients often wear garlic necklaces, not out of superstition, but because compounds in garlic may help reduce porphyrin accumulation. In porphyria, science and folklore create a strange partnership across centuries of human experience. Equally striking is methemoglobinemia, the blue skin disorder that gained fame through the blue fugates of Kentucky, an isolated family whose members had distinctive blue-tinged skin for generations. This condition occurs when the blood contains elevated levels of methemoglobin, a form of hemoglobin unable to effectively carry oxygen. The result? Skin that appears blue, particularly visible in the lips, ears, and nail beds. While acquired cases can result from exposure to certain medications or chemicals, hereditary cases stem from enzymatic deficiencies passed through generations. Treatment is remarkably straightforward. In acute cases, intravenous methylene blue rapidly reverses the condition. For hereditary cases, daily methylene blue or ascorbic acid keeps symptoms at bay. The blue fugates story ended in the mid-20th century when their genetic isolation decreased, and the recessive gene became increasingly diluted in the population. Their legacy reminds us how genetic isolation can preserve unusual traits, and how quickly such traits can disappear when populations intermix. As we examine unusual treatments, none challenges conventional sensibilities quite like fecal microbiota transplantation, the therapeutic transfer of stool from a healthy donor to a recipient. Once considered radical, FMT has become standard treatment for recurrent Clostridium difficile infections, with cure rates approaching 90%. But its applications now extend into territories once thought impossible. Researchers are investigating FMT for conditions ranging from inflammatory bowel disease to autism, obesity to Parkinson's disease, all united by potential connections to gut microbiota imbalance. The procedure itself remains elegantly simple. Donor stool is processed into liquid suspension and delivered via colonoscopy, enema, or acid-resistant capsules. What makes this treatment so conceptually revolutionary is its acknowledgement that we are not merely individuals, but ecosystems are health dependent on the trillions of microorganisms that call our bodies home. As our understanding of the gut-brain axis expands, FMT increasingly represents not fringe medicine, but the vanguard of a paradigm shift in how we conceptualize human health. Finally, we arrive at perhaps the most counterintuitive treatment in modern medicine, helminthic therapy, the deliberate introduction of parasitic worms to treat autoimmune conditions. This approach emerged from the hygiene hypothesis, the observation that autoimmune diseases are virtually non-existent in regions with high parasite exposure, but surge in sanitized Western environments. The theory: certain parasites modulate immune response, essentially training overactive immune systems to stand down from constant battle readiness. Clinical trials have explored helminthic therapy for conditions including Crohn's disease, multiple sclerosis, and allergies. Specially cultivated organisms, typically pig whipworm eggs or the larvae of hookworms, are administered orally or applied to the skin. Regulatory hurdles remain substantial. The FDA considers therapeutic helminths biological agents requiring stringent approval processes. Yet for patients with treatment-resistant autoimmune conditions, this therapy represents a fascinating medical paradox. Sometimes, inviting a controlled invasion may be the path to peace within the body's defenses. As our exploration concludes, we're left with a profound appreciation for medicine's continuing mysteries. The human body, that intricate constellation of systems we inhabit, still harbors secrets beyond our full comprehension. These unusual conditions remind us of medical science's dual nature. For all our sophisticated understanding, we remain humble investigators of phenomena that continually surprise and challenge us. For patients living with these rare conditions, the path forward lies in continued research, innovative approaches, and the courage of medical pioneers willing to venture beyond established boundaries. I leave you with this thought. In the rarest, strangest corners of medicine, we often find our most important insights, revelations that ultimately transform understanding not just of disease, but of human nature itself. The exceptional illuminates the ordinary. The bizarre clarifies the standard. And in medicine's most perplexing mysteries, we often find the keys to its greatest breakthroughs. Until next time, I'm Dr. Eleanor Richards, reminding you that within every medical enigma lies the seed of future understanding. Music fades up and out.